Hi, my name is Lisa, and I'm the nurse who's going to do your health history today.
Oh, thank you very much.
You're welcome. All right, so we're going to start with, do you have any allergies?
I'm allergic to sulfa.
Sulfa, and what sort of reaction?
I get a rash.
Rash, okay, perfect. What do you take for the rash?
What did I take? Probably Benadryl.
Benadryl, okay.
Yeah.
All right, so nothing worse than a rash?
No,
though.
it doesn't, yeah.
Okay, good. All right, and what brings you here today?
I take thyroid medication. I'm hypothyroid, and I've been feeling more tired lately, and I'm not really sure if it's due to my thyroid. I feel like I might need to do a little checkup, get a lab done.
Okay, great. All right. That sounds good. Let me ask you a few questions about your current medications. What medications do you take?
I take levothyroxine, 112 micrograms.
Okay.
And I take fluoxetine, 10 milligrams.
Okay, so the levothyroxine for hypothyroid. All right, and you take that every morning?
Yes.
Okay, great. And how long have you been taking that medication?
For 39 years, isn't that what we figured out?
Yeah, 39 years.
Yeah.
Okay, 39 years, great. And I'm assuming it's effective?
It's very effective.
Okay,
I've
perfect.
had to have my dose adjusted a few times, but it's all good.
Okay, good. And then your fluoxetine, 10 milligrams, what do you take that for?
That was actually prescribed by my gynecologist for hot flashes.
Ah,
When I was about 48 years old. Yeah, she didn't want me to start on hormones and told me an off-label use for Prozac is for perimenopausal symptoms.
Okay, great. I'll have to remember that. So I'm assuming it's working.
It works.
Effective?
It works. It's
Great.
Yeah, it's been great.
And what age did you start that at?
I think I was 48.
Okay.
Yeah.
All right, great. Any other medications?
No.
Okay. What about past medications? Anything you've taken before that you don't take anymore?
No.
Okay. All right. I'm going to do an alcohol and drug screen. We do this annually with everybody. Okay. And my first question is, do you have multiple drinks in one day?
No.
Do you drink at least one drink a day?
No.
Okay. Do you, how many drinks per week?
I wouldn't say, maybe one a week, maybe at the most.
Okay,
Yeah.
So very light drinker, if at all.
Yeah.
All right, great. And then in the past year, how many times have you used recreational drugs or your prescription medications, but for non-medical reasons?
Not at all.
Not at all. Okay, terrific. Then we will cross you off as not substance use disorder.
Okay.
Okay. Nicotine use. Do you smoke any nicotine products?
No.
Okay, great. Have you ever?
I did when I was in college.
Okay. All right. Any other relevant past medical history that I should know about?
I have scoliosis.
Scoliosis. Okay. And at what age were you diagnosed?
When I was 9, I was diagnosed, and I was followed closely. Ongoingly, and when I was 12, I wore a Milwaukee brace.
Okay. For how many years?
For 4 years.
Wow. Okay. That must have been interesting during your adolescent years.
Yeah, it was lovely.
Yeah. But you're fine now. You don't have any weakness or mobility issues?
I just have periodic pain in my back when the muscle gets really tight at the top of my curve.
Okay, and what do you do for that?
I take ibuprofen, about 600 milligrams. That seems to help.
Okay, any stretching, exercise, yoga, things like that help?
Actually, that really does help, and I should do more of it.
There you go, okay. And then how much ibuprofen do you take? Like, how frequently do you have to take the ibuprofen?
I started taking it every morning just because it seemed to get me through the day without a problem. So I should have said that was something I take every day.
Okay.
Now that I think of it.
And how much?
600 milligrams.
Okay. And no issues you've had your kidneys checked, no issues?
No issues.
Okay. Let's see. Let's go to surgical history.
Okay. So tonsillectomy when I was 15, I think. And that is, appendectomy when I was 45.
Okay.
Yeah.
All right. Tonsillectomy, I'm assuming no complications?
No.
Okay. What about the appendectomy?
No complications with that.
Okay. Yeah. All right. Good to know. How long were you in the hospital for afterward?
With the appendectomy, I was in the hospital for a week.
A week.
Yeah.
Why so long?
When I first presented to the ER, they weren't sure what was wrong with me. It turns out my appendix had been leaking.
Oh.
And my intestines encapsulated the infection, which is a good thing.
I guess you're right. That way you didn't go septic.
Right. And so by the time I got there, I didn't even have a white count when I went there. They just had me under observation, and then slowly things began to develop.
Okay.
And that's when they figured it out.
Okay.
Yeah.
All right. Any other hospitalizations, whether it be surgical or otherwise?
Nope.
Okay. How many children do you have?
2.
2. Natural childbirths?
Yes.
Okay, great. Then let's go to social history. So, do you live alone? Do you live with someone?
I live with a partner, a man partner.
Okay. All right.
Yeah. In a house.
All right, great. And what sort of work do you do?
I'm a nurse practitioner.
Oh, you are?
Yes.
Great.
Yeah.
Okay, nice. All right. That's great. And then what sort of hobbies do you have?
I like to paint and draw. I like music. I like dance.
Okay.
Yeah.
Great. All right. Let's go to family history. Let's kind of go down and ask about all the different systems, and you'll tell me anyone in your family, aunts, uncles, grandparents, siblings.
Right.
Anyone with heart disease?
Not really sure. I think probably on my mother's side. Perhaps her father. Not sure.
Okay. Okay. All right. Anybody else in the family who might have heart disease?
Mm-mm.
Okay. What about diabetes?
Diabetes on my father's side. His father and his grandfather both had type 2 diabetes.
Okay, great. Any issues with stroke?
No.
Neurologic issues, seizures,
Mm-mm.
and cancer?
No cancer.
No cancers? Okay. What about respiratory?
Wait, you know what? My mother's brother had lung cancer.
Mother's brother.
And he died of that.
Okay.
I had that.
Okay. What about respiratory issues?
No.
Any addiction issues in the family?
Except to cigarettes.
So,
And
yeah, it
nicotine.
is an addiction.
Yeah.
You're right. All right. Any issues with activities of daily living? Anything that you struggle getting upstairs? Walking upstairs?
Not yet.
Yep, I know. You're right. Okay. So you're able to do everything on your own. Your laundry.
Yeah.
Okay. Perfect. Let me ask you a little something about diet. So, what's your diet like? What sort of foods do you eat?
I like everything. There's nothing I don't eat.
Pretty healthy eater?
Pretty healthy. It could be better. I eat too much sugar. I love bread,
Okay.
So
All right. Do you use whole wheat bread?
yeah.
Okay, great.
Yeah.
Sugar, what forms of sugar?
I love ice cream.
Ice cream, okay. All right, but you eat plenty of fruits and vegetables?
Mm-hmm.
Okay,
Yeah.
good. And do you eat 3 solid meals a day, or do you snack more?
More like a grazer.
Okay, that's actually healthy.
I maybe eat one larger meal, and it can be either lunch or dinner.
Okay. All right,
Sometimes
great.
like at 3 o'clock, so it's...
Right, exactly.
Is
Okay, but
that
you have...
dinner?
yeah, there you go, dinner. But you eat fruits and vegetables, and okay, great. All right, so let's go to a review of symptoms. And I know generally you said you came in because you have some fatigue. You think maybe your thyroid meds are off, or your thyroid,
Maybe.
your meds might be adjusting, might need adjusting. How's your sleep?
Sleep is good. I do wake up probably out of a week, I would say 4 out of 7 nights. I might wake up in the middle of the night around 3 o'clock.
Okay. Do you stay up, or you just wake up briefly, go back
I don't
to sleep?
stay up. I usually go back to sleep.
Okay, good. So you feel rested when you wake up?
Yeah,
All right. And about how many hours do you think you get of sleep a night?
at least 6.
Okay. Do you need
That's
more
probably
than
about
that,
average.
or
No.
okay? So okay, great,
Yeah.
great. All right. Any abdominal issues?
Nope.
When was the last time you had a BM?
This morning.
Oh, so you're regular with
Very
BMs?
regular. Very
Okay.
regular.
No issues with constipation, diarrhea,
Nope.
stomach aches, cramping, nothing.
No.
Okay, great.
There actually is colitis in my family. And there
Okay.
actually is. So funny how I like think of things. Just some GI stuff that seems to be around. Like my nephew has a problem, and my son David has a little bit of a stomach thing. He's had to really look at his diet and figure out what he can tolerate and can't. So I don't know if that's anything.
Okay. But no issues for you personally?
No.
Okay, that's good. Okay, just checking. Skin, any issues with skin, any rashes or skin breakdown?
Nope.
Extremely dry skin?
No, I would say I'm normal.
Okay. All right, great.
I bruise because I bang into things.
Oh, that happens. Okay, extremities, no issues with
No.
extremities, no numbness, tingling,
Mm-mm.
no mobility issues?
No.
All right. Hearing,
It's good.
okay, no issues, no ringing in your ears or
Mm-mm.
drainage or anything?
Mm-mm.
Okay. I just said ears.
Eyes?
Hearing, ears, yes, sorry. Your eyes.
Yes. I wear eyeglasses,
Okay.
for reading
For
and
reading.
computer and stuff. Yeah.
Okay. All right. Nose, any congestion or?
No.
Okay. Perfect. And then teeth.
It's all good. I got regular dental care.
Great. And then, I'm sorry, I meant to say throat.
And throat? My throat's fine.
So just the thyroid. That's the only.
Yeah.
But you don't have like frequent coughs or congestion or anything like that?
Mm-mm.
Okay. All right, great. So genital urinary, I'm going to ask things like if you have pain on urination or frequent urination or dribbling or anything like that.
No.
Okay. Endocrine, we already said thyroid.
Mm-hmm.
Anything else endocrine related? No diabetes, right? For you.
No.
Okay, heat cold intolerance?
No, I'm fine.
Okay. Neurologic. So you don't have seizures, frequent headaches,
Mm-mm.
dizziness?
Mm-mm.
No. Okay. Respiratory, lung issues?
Nope.
I think we sort of spoke about musculoskeletal and that, mobility, no breaks, no bone breaks,
No.
anything like that. Scoliosis, we did mention.
Right.
Okay. Then cardiac. Any cardiac history?
Mm-mm.
No. Sexual health. Any issues or concerns?
Nope.
Okay. No current STDs. Not taking any medications for anything?
No.
Okay. All right. So I can't think of anything else I might have to ask you. Do you have any questions for me that you would like answered?
I don't think so.
Okay.
It was really nice meeting you.
Nice to meet you too. Thank you so much for coming in.
You're welcome.